Today we're discussing a vital topic in critical care: fluid resuscitation in ICU patients with hypovolemic shock. The question we're tackling is whether colloids or crystalloids are more effective in improving survival. Let's dive into the findings from the CRISTAL trial and what they mean for patient care. Hypovolemic shock, often resulting from severe blood loss or dehydration, requires rapid fluid replacement to restore blood volume and prevent tissue hypoperfusion. The main types of fluids used are crystalloids, like normal saline and lactated ringers, and colloids, like albumin and hydroxyethyl starches. While colloids may better retain fluid within the vascular space, the evidence of their clinical superiority was unclear. Conducted from 2003 to 2012 across multiple countries, the CRISTAL trial randomized 2,857 ICU patients with hypovolemic shock to receive either colloids or crystalloids for fluid resuscitation. The primary outcome measured was all-cause mortality at 28 days, with a secondary focus on 90-day mortality. This large-scale study aimed to provide clarity on which fluid type offers better survival benefits. The CRISTAL trial found no significant difference in 28-day mortality between the colloid and crystalloid groups, with rates of 25.4% and 27.0% respectively. However, a slight reduction in 90-day mortality was observed with colloids, at 30.7% compared to 34.2% for crystalloids. The authors advise caution in interpreting this as a definitive benefit, suggesting that more research is needed to confirm these findings. According to the Surviving Sepsis campaign, crystalloids are recommended as the first choice for initial resuscitation in severe sepsis and septic shock. The use of hydroxyethyl starches is discouraged due to concerns about kidney damage and bleeding risks. These guidelines reflect the current consensus in the medical community, prioritizing patient safety and efficacy. The CRISTAL trial was open-label, meaning clinicians knew which fluids were being administered, potentially introducing bias. The long recruitment period and early stopping due to insufficient enrollment may have affected the study's power to detect differences. No significant adverse events were reported, though this aspect was not a primary focus of the study. These factors highlight the complexities and challenges in conducting large-scale clinical trials. The CRISTAL trial provides important insights into fluid resuscitation practices in critically ill patients. While the choice between colloids and crystalloids doesn't appear to impact 28-day survival, the slight difference in 90-day mortality with colloids suggests more research is needed. Ultimately, the choice of fluid should be guided by clinical judgment, patient condition, and current guidelines. Thank you for watching. If you found this video helpful, please like, subscribe, and hit the notification bell for more updates on critical care and medical research. Stay informed and stay safe.